South Africans count their days until the end of lockdown this April. We look at what other countries are going through. Like most across the world, India is also at a crucial juncture in its fight against COVID-19. The country says it has responded with urgency and determination. The government has reportedly aggressively stepped up its response measures. Find, isolate, treat and trace. That's what they've done. Prime Minister Modi has extended the nationwide lockdown until the 3rd of May. To tell us more about India's response to the coronavirus, we're joined now via Skype by India's High Commissioner, or via telephone to India's High Commissioner to South Africa, Mr. Jaideep Sarkar. Very good evening to you and thank you so much for joining us, Ambassador. All right, we'll see if we can get him back on the line. But let's just look at the impact of the coronavirus in other countries as well. As we mentioned, that Spain itself has managed to keep down the figures by employing aggressive measures. And in Mexico, a very interesting story coming out of there. Indigenous women are using palm leaves to make face masks. So countries are innovating. In Uzbekistan, they've prolonged the coronavirus-related restrictions as well, while Croatia has extended its lockdown until May the 4th. So South Africa's, or rather India's ambassador to South Africa, Mr. Jaideep Sarkar, joins us now on the line. A very good evening to you, Mr. Sarkar, and thank you so much for speaking to us.
Thank you very much for having me on your show.
All right, so let's talk about the steps that you've taken in India to fight COVID-19 from the get-go.
Okay, so let me make a few points which I think would be of interest. To begin with, even before the first case was detected in India on 30th of January, 2 weeks before that, we started a surveillance and screening program at our airports. And progressively thereafter, the restrictions started getting imposed. And eventually, of course, a lockdown was imposed on the 24th of March, and that's to extend till 3rd of May. But I think that there was recognition within the Indian system that early on that this is a serious crisis and that steps have to be taken early and enforced strictly. The second aspect is the gearing up of our public health system. And let me say that this is not the first disaster we are facing. I think in India, the administrative machinery is used to facing floods, earthquakes, tsunami, and even pandemics. And therefore, I think even our public health system is soft and hardwired to meet these kind of challenges. For example, the integrated disease surveillance program has been in existence since 2004 and has been quickly rolled out to cope with this with the virus. So the public system has been geared as best as possible. There has been fairly aggressive surveillance through community surveillance and also contact tracing. The Indian government has launched an app called Arogya Setu. Arogya means health and well-being, and Setu means bridge. And through this app, we have tried to improve contact tracing, provide information and to people, and also register their health details. More than 50 million people have downloaded this app. Lastly, I think even our Prime Minister, Mr. Modi, has been advocating on behavioral health, not only social distancing, but maintaining your mental balance, immunity boosting through traditional simple practices like yoga and Ayurveda.
Now, I'm very interested in this. As you mentioned, you also face challenges, and that's why you use the app. And part of those challenges have been high-density areas, what some would call slums in your area, where you experienced the first death, among the first deaths there. How did you deal with those challenges?
Well, as I said, these are all the measures. I think I don't think any country has a magic wand to deal with this problem, and we really got to get down to the basics, which is to make full use of all the resources, the public health system, as I mentioned. As an example, our railways, now the trains are not running, and so we are using the trains to provide as quarantine facilities if and when they are required. So I think that the entire government machinery is working as best as it can. As far as I think the hotspots are concerned, I think the community surveillance has been very effective in some of the places, including in Kerala and also in Rajasthan, two of our states.
Just speaking about some of the measures that Prime Minister Modi has taken, he's extended the lockdown to the 3rd of May.
Yes.
Now, the number of COVID-19 infections crossed 13,000 with over 450 deaths. But there was also what you saw, a problem of migrant exodus. How were you able to arrest that?
Yes, there has been, I think, this migrant excess because a large number of people live on daily wages. It's been a sort of balancing act. We had to have the lockdown. At the same time, the needs of all these people also had to be taken into account. And I think the district administrations in various places where this migration has taken place, they have tried their best to gear up. A large number of camps have been set up. Soup kitchens have been set up to cope with this crisis. Also, by the way, for the families of the migrant labor, they are of course moving. The government of India has provided assistance, cash transfer assistance of about $4 billion to 320 million Indian citizens. And this is through a scheme of direct benefit transfer where the cash goes straight into your account. And therefore you don't even have to go and travel. The social distancing is maintained. So I think even for the migrant labor who have lost their jobs, at least when they get back to their homes and families, they will have some sustenance to keep them going till this crisis is over.
You've also said that as a country you've learned from the crises in Asia, in the US, for instance. With what you're confronting, a shortage of diagnostic tools and protective gear, how have you been able to, overcome these challenges?
Well, yes, I think we are certain, like I guess many other countries, facing the problem of providing good PPE, protective gear and so on. But I think that our industry has responded. For example, we had no capacity to manufacture these protective suits before this crisis. But remember that India also has a very well-developed textile industry, and in a very short period of time, we have now ramped up capacity to about 30,000 suits per day, making use of our textile industry and other manufacturing facilities. Our auto companies, some of them are manufacturing ventilators. Self-help groups are making masks at home. So everyone is pitching in. Of course, the shortage is there, but we are making, all-out efforts to deal with this problem.
Thank you so much for speaking to us. India's High Commissioner to South Africa, Mr. Jaideep Sarkar.